watching Omaha's ABC, KETV, Channel 7. Your favorite choice for local news. This is KETV NewsWatch 7 at 10.
It affects thousands of women every year, and it can be deadly.
But early detection can be a lifesaver. Ask this Omaha woman. She's a cervical cancer survivor, and she's sharing her story with us right here on KETV NewsWatch 7. It's a cancer affecting roughly 12,000 women in the U.S. every year, a deadly disease in about 1/3 of the cases.
And tonight, a local woman shares her survivor story, a battle with cervical cancer. As KETV NewsWatch 7's Nichole Berlie reports, the cancer is not only treatable, it's preventable.
Jenny Nelson's diagnosis came in the fall of 2008.
I went for a routine OB-GYN visit.
The mother of 3 says a spot on her cervix turned out to be cancer. Radiation and chemo started just days later.
It was overwhelming. Overwhelming, a little bit of shock, a little bit of kind of surreal that how could this be happening to me?
The primary but not only cause of cervical cancer is HPV, or human papillomavirus.
No side effects of the treatment.
Methodist Hospital Gynecologic Oncologist Dr. David Crotzer says exposure to HPV can happen years before cancer actually develops.
It tends to affect women in sort of the middle ages, between probably the ages of 40 and 55.
There are 3 basic ways to prevent or detect HPV, and therefore prevent or detect cancer.
That's by having a pap smear, or by having the HPV or human papillomavirus vaccine, or by being pre-screened for prior exposure to the HPV virus.
I do counsel patients that even if a patient has cervical cancer, if it's detected early, it can still be cured.
After successful treatment, 36-year-old Jenny Nelson is now 2 years cancer-free with a new outlook on life.
I don't sweat the small stuff anymore. I look at the big picture and just continue to go on every day like it may be my last.
Nichole Berlie, KETV, NewsWatch 7.
Cervical cancer is currently treated through surgery or a combination of radiation and chemo. Dr. Crotzer says new research trials are examining less invasive surgery to help younger patients maintain their fertility.